The question is, do you have any advice when we're trying to make goals on deficits through distractive techniques?
Yeah, that's a great question. And I think as neurologists, we have the same problem that we're a bit too deficit and impairment focused. Well, I think it's okay to have some sort of limb focused therapy, but it has to, for FND, it has to be, promoting this automatic movement using distraction. But I think rehabilitation focuses more on tasks. So someone might not be able to use their arm properly, but can they still play the violin like they did when they were 12?
Mm-hmm.
Or someone might have a really weak leg, and you'd say, well, shall we try a bit of ballet dancing? Because you used to love ballet dancing or ice skating. And you've got to be kind of creative but based on what those person's experiences and where their strengths are and their motor programs. So if you think of motor programs more as a focus of where the impairments are, then that might help. It certainly helps my more categorical brain.
And with 3PD, there has been with functional imaging showing, an over reliance on visual cues and under reliance on somatosensory, an increased response from the amygdala. In functional neurological disorders, when I hear you talk about the difference between voluntary movements versus involuntary, has there been anything with the basal ganglia, any changes seen in that?
There are networks relating to basal ganglia as well, yep. But actually, it's not so much the primary motor system, it's more the things that are around that, the sort of higher motor control, the way the limbic system connects with the motor system. Yeah, I don't think we've got an all-encompassing answer about what the network abnormality is in FND, but I think it probably involves all of the above, unfortunately. I think it's going to be a very long time before we have definite answers on that one.